Hello everyone, today we're going to talk about how to reverse the coronary heart disease within just a few months. Before you think this is some kind of joke, I was a coronary heart disease patient over 12 years ago, diagnosed with 3 blockages, 25, 30, and over 95%, which over 95% stent was placed at the Trillium Hospital in Toronto. 3 months prior to that, I had a 1.4 centimeters of kidney stone, which was removed at the Civic Hospital north of Toronto. And about over 9 years ago, I reversed both conditions completely. They were put into remission, backed by medical exam at the hospital, and confirmed by my urologist and cardiologist. Today in this video, I'm going to share my experience and cover the coronary heart disease, actually what coronary heart disease is, and go through the root causes and cover the cholesterol, which is the most confused topic around the world, and vast majority of the people, they're fearful of that. Trust me, by end of this video, your perspective is going to be totally different when it comes to coronary heart disease and cholesterol. Before I start, I'm going to begin a couple of minutes with myself because I'm a live example. After my both kidney stone surgeries and catheterization stent, every few months I had a regular visit with my urologist and cardiologist. Finally, after a year and a half or so, close to 2 years, when I visited my urologist, the test result showed that my both kidneys stone form again, 0.5, 0.6. And the visit with my cardiologist, based on a stress test result, my stent narrowed down about 40%. Since my kidney stone was a calcium stone, which was sent to the lab, which majority of the calcium stones are calcium oxalate. So I started doing my research, what causes the kidney stone to form again in the kidney and how I can approach it naturally and holistic way. Finally, through my research, I find a lady from McMaster University of Canada who's got a PhD in naturopathic and degree in biology. So she wrote the book, it's called Calcium Paradox, and her name is Kate Ryan Blue. Basically, she was saying there's a vitamin missing from North American diet can remove the calcium from unwanted area, like your kidneys, arteries, joints, anywhere else that it's not supposed to be. And other studies confirmed the same thing, and I decided to give it a shot, and magic happened. So I get back to me later with the medical exam at the hospital and sources of the vitamin. I know some of you want to know the vitamin right away. Of course, I'm going to share it and show you the sources and which one is going to give you the quickest result. And as I said, the fear that is lingering around your house about coronary heart disease and cholesterol is going to leave your house for good. And my goal is over the years, not only about coronary heart disease, about other diseases and health conditions that I educated myself, inform people with the disease, show them the root causes, and provide them with the tools so they can improve and reverse their condition. As a disclaimer, this video is just a personal experience for educational purposes, and it's not intended for any professional medical advice. So let's dive right into it. What is coronary heart disease? Coronary heart disease is just the inflammation of the arterial walls. And inflammation is the cause of every single disease, from the simple cold and flu to fatty liver to diabetes, Alzheimer, arthritis, PCOS, and the rest of the list. And inflammation of the arterial walls, it does not happen overnight, months, or a year. It takes years and decades. I'll explain it when I get to cholesterol. When the inflammation is completely formed, plaque starts building up. Normally, when the plaque is over 80 and 85%, the symptoms are going to show up at the door. And not everybody is going to have all the symptoms, but the main two ones are chest pain and shortness of breath, arm pain, jaw pain, back pain. And some people experience the symptoms mild, some people experience it severe. Like I had a chest pain and arm pain, severe. Then individual ends up going to the hospital. At the emergency room, from the first ECG or EKG, they can evaluate the severity of the blockage. Then he's sent to the operating room for angiogram. If there is room, they put a stent in to resume the blood flow to the heart. And if there is no room anymore, they have to do an open heart bypass surgery, which they take a piece of vein from the arm or the leg, they bypass that 100% so they can resume the blood flow to the heart. Now this is going to get interesting. Apparently, the coronary heart disease does not cause any death based on the science. Person can have 100% blockage, they get a bypass surgery. Individual survives. You might know someone with a bypass surgery is still doing his daily routine. I know one good friend of mine, about 15, 16 years ago, one of his blockages was 100%. So he received the bypass surgery and he's still doing his daily routine. So person can have two of them, double bypass, triple bypass. And everyone on this planet calls the coronary heart disease and heart attack number one cause of death. Actually, I'm lying. About 11 years ago, short clip from one cardiologist from Boston University, he was saying the same thing. Coronary heart disease does not cause any death. So the question is, when they say 350,000 people in the United States every year, they lose their lives due to coronary heart disease and heart attack, 35,000 in Canada, whatever the numbers are in UK, Australia, elsewhere. So if this is not causing death, what is causing death? Any guess? That's a cardiac arrest. It's a totally different heart condition. We have many different heart conditions. For a slow heartbeat people, they receive pacemaker. We have heart valve issue. We have heart failure. So that's a totally different heart condition. Cardiac arrest happens two ways: overdose drugs and obesity. That's the only part they're correct, obesity. Throughout the video, I'm going to give few examples. That's going to make it easier for everyone to relate where I'm coming from. Overdose drugs. For example, Michael Jackson, Prince, Tom Petty, Matthew Perry, and so many others that we don't know. That's the overdose drugs. According to data, out of the 350,000 every year in the United States, approximately 100,000 of them is due to overdose drugs. And the remaining 250,000, it's 99.9 obesity. Obese people over the years, they develop a heart condition, it's called cardiomyopathy, which heart becomes enlarged, heart muscles are thickened and stiffed, and heart has to work harder to pump the blood throughout the body. An imbalance in electrolytes over the years and decades because of this North American standard diet, which our heart depends on the balanced electrolyte, which is our natural pacemaker within the heart, generate the electricity for the heart to beat. So at some point, the heart is going to stop beating and the individual collapses. And if they don't get him to the defibrillator within 15 minutes, to give the electric shock to the heart to restart again, no more blood reaching the brain, and it's over. So when I say they know it's obesity, when I attended the cardiac rehab at the hospital to see what's going on, basically they're trying to educate you with the lifestyle, exercise, and diet. They don't know anything about the diet. As soon as you enter the hospital, there is a vending machine with those drinks loaded with sugar, and their food is worse than an airline's food. And they have coffee shop every single hospital. I'm talking about the coffee shop chain in North America. What could be wrong with the coffee shop? Some of the drinks and items they sell, they have more sugar than a can of soda. And people are inflamed and they're trying to deal with their diseases and health condition, and they have them available to them. It's like putting a gasoline on fire. And at the same time, I'm skinny like a toothpick. Another guy beside me, the same thing. They keep telling us to lose weight, maintain a good weight, especially lose belly fat and visceral fat. We look at each other. I said, there's nobody overweight in here. What are they talking about? At that point, I realized these guys, they have no idea what they're talking about. So unfortunately, those obese people, they lost their lives to different heart condition, cardiac arrest. By the way, being overweight or skinny does not indicate how healthy or unhealthy the person is. I'm skinny, I could be pre-diabetic at the same time. Now they put people on a cholesterol lowering medication, statin drugs. Let's start with the side effects. First one, increases the insulin, leads to diabetes. Second one, rhabdomyolysis, which is the muscle breaking, muscle tearing. And normally happens with a very intense exercise in a short period of time. And I don't think the heart patients, they go to the gym to do intense exercise. And by the way, not everybody is going to have all the symptoms. Number 3, memory loss, which I had it, leads to dementia and Alzheimer. Number 4, muscle wasting, weakness of muscle, and which I also had it. Number 5, some people reported joint pain. And number 6, probably you never heard of it. People, they take the medication at the age of 50s or 60s or whatever the case is, they don't pay attention, but I did. Slightly speed up the aging process. I notice I'm getting wrinkles around my eyes quicker than the normal aging process. I tell you the reason. Once they put people on statin drugs to lower the LDL, it lowers very important enzyme. It's called coenzyme Q10, which is the most powerful antioxidant our liver makes it. And it's crucial for our muscles and our heart muscles, and powers the ATP, which is the storage and use of energy at the cellular level. And 3 symptoms from the statin drugs: muscle wasting, muscle breaking, and slightly speed up the aging process. It's due to low production of the coenzyme Q10. The purpose of putting people on statin drugs for primary prevention or secondary prevention. According to Dr. Asim Malhotra, which is a well-known British cardiologist, and he's been on many podcasts, including Joe Rogan last year, out of 39 people, just one of them did not receive second coronary heart disease, and they were all on statin drugs. Guarantee you that one person changed his lifestyle and his diet. Based on cardiologist report, 50% of the people that they received the stent or bypass surgery and they had a coronary heart disease, they had the lowest number of total cholesterol that they're telling you should have. It's below 200, 190. 4 decades ago, 280, 300 was acceptable and normal. What was the coronary heart disease rate at that time? What is the coronary heart disease today? Is it going down or it's going up? This disease 2 decades ago was middle-aged disease, like 50 years old, 60 years old, and 70 years old. Based on their data, 35 years old, 40 years old, they're developing this kind of disease. So it should clearly tell you that the numbers do not have any effect on this disease because they're targeting the wrong guy. Oh, somebody might say right now, oh, it's not the LDL the problem, it's the oxidized LDL, small dense, or VLDL, very low density lipoprotein, whatever they call it. Basic common sense. Our liver makes only one LDL, does not make one LDL normal and other one oxidized. I'll explain it when I get to cholesterol. And also, they had a study statin people, according to Dr. Asim Malhotra. They did the study for 5 years on people that they were taking the medication. They calculated that they add 4 days to their life. Actually, one podcast, I believe Dr. Asim said 4.2 days. Look at the accuracy. 4 days, 4 hours, 53 minutes, 29 seconds. Seriously? They don't even know the cause of death. Never mind the study. Now we're gonna go through the root causes. We can talk about the diet and food for hours, but we want to make it as short as possible and informative. Number 1 is sugar, high fructose corn syrup, which is done in the lab. They add enzyme to the cornstarch to convert the glucose to highly concentrated fructose, which is 2 levels, 42% and 55%. And corn, over 95% genetically modified, and high in omega-6 and very inflammatory. The 42% they added to over 75% of the product that you see in the grocery store, especially all those aisles in the middle. From your jam, peanut butter, Nutella, cereal, cookies, cakes, ketchup, canned soup, ice cream, and some frozen stuff. Over 75% or 70 to 75%. And the reason they added to enhance the flavor. Basically, they want to bring it to the point. It's called bliss point. It's the point that you like the product the most and becomes addictive and irresistible. And there is a problem with the fructose, which is it does not stimulate the hormone. It's called leptin, which is the fullness hormone, to send the signal to the brain that you're full. On the other hand, stimulate the hormone is called ghrelin, which is the hunger hormone for you to eat more. That's why a lot of people, they keep eating without feeling full. And the 55% concentration, they added to so many drinks, from soft drinks, juices, energy drinks, etc. The next one is called seed oil. That's what they call it. These are not seed oil. These are all industrial oil. They go through a lot of processing to look like that on the grocery shelf. How do you get a 1 liter of sunflower oil out of one bag of sunflower seeds? You need 6 of them. So they're all industrial oil, maybe corn and soybean, because of the massive production in the United States and heavily subsidized, and both high in omega-6 and highly inflammatory again. Actually, these oils are hydrogenated oil. We have 2 types of hydrogenated oil, partially hydrogenated, fully hydrogenated. Fully hydrogenated, they add it to so many products. They say it's for the shelf life. What shelf life? It's already oxidized. Like if you look at the mayonnaise or peanut butter, it doesn't have an expiry date. It has a date, it says best before date. There's no expiry date. So are they telling you when it's going to expire? You figure it out. And the next one, it's a partially hydrogenated oil, which is the liquid form, which you do frying at home, you eat outside, French fries, onion rings, fish and chips, or anything that they do in those oils. As soon as that oil is heated and exposed to the oxygen, becomes fully oxidized. It means the product that you're eating, it's already oxidized. It means if you fried one of the healthiest fish, which is sardine, you just oxidize the sardine. There is no nutritional value whatsoever. And the reason they add hydrogen to the oil, to increase the heat tolerance, increase the smoke point. You increase the heat for olive oil, you see the smoke. You increase the heat for the butter, it starts turning brown, which is no good anymore. The deep fryer is boiling like a volcano, you don't see the smoke. Imagine what kind of oil is that. The next one might surprise a lot of you. It's a bacteria from the mouth. From poor dental hygiene over the years, bacteria keeps getting into bloodstream and starts damaging the arterial walls or root canal. I knew about it from Dr. Weston Price. He was a Canadian dentist, one of the greatest researchers. And recently the doctors and scientists saying that root canal can lead to some of the health issue in human. Basically, the root canal, they cannot clean the bottom of the canal completely, so they leave that tissue in there. And that tissue attracts bacteria. They remove the nerve, there's no blood supply, white blood cell to deal with the bacteria. Bacteria linger around and you don't have any pain, everything is good. Eventually, through the tube on the bottom, it gets to the bloodstream. It can damage the arterial walls and cause issue other parts of the body. And the next one, smoking. We all know that the smoking causes inflammation. And the one after is a blood pressure. High blood pressure can damage the arterial walls and thicken the arterial walls for the plaque to start building up, or the outer theories might be like a pimple form and burst and cause blood clot. The next one is the homocysteine level. The theory is elevated homocysteine level, which is an amino acid, can contribute to arterial damage. It's a very easy fix. The reason that it's elevated because of the deficiency in B6, B9, and B12. Instead of having those boxes processed sugary food that they're telling you it's your breakfast, have 2 eggs, half an avocado, you get all the vitamin that you need, and you start your day healthy. As a reminder, you can also book a consulting call. So let's get to the monster cholesterol, which majority they're worried about it. We have 2 main ones. They're called HDL and LDL. Everyone calls it a good cholesterol, bad cholesterol. Even your doctor calls it a good cholesterol, bad cholesterol. They made it so easy so even the kids understand. There's 3 little guys involved in here. Most of you never heard of it because how I say it confidently, your doctor doesn't know it. Because back then they were saying one of them might be the marker about 11 years ago, LP letter A. I wanted to do the test and I went to 3 doctors, 2 first walk-in clinic. They didn't know. Finally, I went to my family doctor. He also didn't know. And I asked him for requisition sheet so I can look at it. It was close to the bottom. Lab knows about it. Doctors don't know about it because it's a specialty. And back then they were saying that LP letter A might be the marker, which it didn't mean anything. I did the test. Now recently, for the past year or so, they're saying another one, APOB, might be the marker. Every decade the marker changes. None of these guys are the marker. Every single of them are made by our liver, and everyone has a job to do. Let's get right into it. HDL stands for high density lipoprotein. LDL stands for low density lipoprotein. What is the job of HDL? To recycle extra LDL from the blood back to the liver. Very simple. What is the job of LDL? Super important. LDL is responsible to make most of our hormones. Estrogen, testosterone, progesterone, aldosterone. Cortisol is responsible to make bile, to break down the fat, which our liver makes it stored in gallbladder. It's responsible to make vitamin D at the cellular level. Without this guy, we cannot make vitamin D. And from head to toe, we're made of trillions of cells. And every cell membrane, which is the protective shield to separate the internal environment of the cell from external, it's made of fat, cholesterol, and protein. The name is right there, a lipoprotein. How is this guy a bad guy? He's doing all wonderful things for our body. Our life depends on it. Without this guy, we wouldn't exist. We wouldn't be having this conversation right now. He's a life cholesterol. Now we're getting to the 3 letter guys in here. LP letter A, APOA, APOB. APOB belongs to LDL. What is the job of APOB? APOB allows the LDL to attach to the receptor at the cellular level and the liver. Very simple. We have APOA. What is the job of APOA? APOA belongs to HDL, so-called good cholesterol. It works like an ignition for the car, starts the engine for HDL to do the recycling of the LDL back to the liver. Now we're getting to LP letter A. Pay attention, everyone, that's where the problem occurs. LP letter A is the driver of the LDL wherever it needs to go. Unfortunately, this driver, you want to call him a bus driver, Uber driver, taxi driver. He picks up 2 wrong fats. When the storage in the liver is full with the fructose, liver has no choice to convert that to the fat, which is the triglyceride in the blood. From those harmful oils consumption, Now you have the trans fat in the blood. He picks up these two wrong passengers. You remember I said earlier, I'm going to explain it when I get to cholesterol. So now LDL either gets oxidized by trans fat or glycated by triglyceride. They still go attached to the receptor in arterial walls. They do the damage. Now, here comes our defense mechanism system, which is our white blood cells, and they form the body's army or macrophages. They take the enemy, and LDL, which is the repairer, it goes back to repair that area again. And the process of getting damaged and repaired over the years and decades. You remember earlier I said inflammation of the artery? That does not happen overnight. It takes years and decades. So this vicious cycle keeps going on for years and decades until few spots they get more hammered than the rest of the arteries. Like I had 3 of them. Somebody might have 2, the other person might have 4. Once the inflammation is completely formed, plaque starts building up. And you've been told over 4 decades or so, the arterial plaque is caused by fat and cholesterol. Arterial plaque is caused by calcification, calcium buildup. That's why some cardiologists suggest to get your calcium score test before you jump into anything else. Now let's go back to me with the medical exam at the hospital to prove it. After taking the vitamin for a few months, I booked 2 appointments with my urologist and cardiologist. So when I visited my urologist, they did all the tests from ultrasound, x-rays, prostate check, and the result came back. My both kidney stones were gone, my prostate was back to normal, and my urine flow was normal. So I didn't need to go see my urologist anymore. And by the way, I never discussed anything with my urologist or cardiologist what I did, because I didn't want to have a discussion of the holistic approach with the modern medicine. When I went to see my cardiologist, I asked him if I could do angiogram because I have a feeling that my condition is reversed. He says, if you don't have any symptoms, it's not really recommended to do angiogram, but he said he could do nuclear test, which over 90% accuracy. And he booked it for a few days after. Basically, nuclear test, they inject a radioactive tracer into the blood. They test your heart at stress on treadmill and 2 times at rest, which is the scanner. And the process takes about 3 hours or so. And the scanner keeps taking picture of the arteries and the heart to evaluate the blood flow to the heart and detect any blockage. So the result came back. There was nothing reported on that. My arteries were completely cleared and normal blood flow. I'm going to give you guys a quick story to seal the deal. And it's a personal animal experiment, and it's 100% relevant to what we're talking today. We had a puppy. He was 17. He died early during COVID, and he lived good. I used to incorporate safe human food in his diet. And year before COVID, he had a discharge in his left eye. He had a hard time to open his eye. So finally, my wife took him to his veterinarian. Apparently, he couldn't figure out what it was. So he was scheduled for the eye specialist for the dog. So after a week or so after the visit with the eye specialist, I see the dog's eye the same, nothing is changed, and no medication, no drops around. So I asked my wife, so what's going on with his eye? It's still the same. So what did they say? She goes, he has to go back for follow-up in 6 months. I said, you just spent over $900 and they're telling you he has to go for follow-up in 6 months? So I asked her, did they say what's going on? What's causing that? She says, yeah, they say it's a calcification. So what I did, even though there is no toxicity with this vitamin, and his body was smaller, I divided the vitamin in 3. It comes in a powder form in a capsule. I play safe, and I put it in soft part of the bread, and every day I included that in his food. Within less than 3 months or so, his eye was completely cleared and cured. So what is this vitamin? It's called vitamin K2. They come in 2 main forms, MK7 and MK4. MK4, you find it in animal products like grass-fed meat. When I talk about meat, it has to be 100% grass-fed. Grass-fed meat, grass-fed organs, grass-fed butter, eggs, and some cheeses, especially European cheeses, I prefer because they have a way better standard than North America. And you also find it in a kefir, which is the fermented product of the dairy product. And the second one, MK7, it comes in a fermented food like kimchi, sauerkraut, miso, anything fermented. Even if you do fermentation at home, any vegetable that you like, you can do it. There's a lot of videos on YouTube, you can do it. The one that I started to take, it was the fermented soybean from Japan. It's called natto, which has the highest concentration and it gives you quickest result. Now the question is, how does the vitamin K2 work? Vitamin K2 works by activating two proteins in our body. One is called matrix GLA, the other one is called osteocalcin. Once the matrix GLA is activated, removes the calcium from unwanted area like arteries, kidneys, joint, under the skin, anywhere that is not supposed to be. The other one, osteocalcin, when it gets activated, takes the calcium where it's needed, like your bone and your teeth. So take away from this video, if anybody decides to supplement with the vitamin K2 fermented soybean from Japan, 100 microgram is more than enough. And if anybody around the world, they're taking a blood thinner, it's called warfarin or Coumadin, another brand. This is a very heavy duty blood thinner. And there were some cases of blood clot combining the vitamin K2 fermented soybean from Japan and the warfarin. So you might want to check with your doctor before supplementing with that. Along with that, you can take a vitamin D, and if you have the sun available, use the sun. Don't take the synthetic one. And when you're taking the vitamin D3, you need vitamin A because they enhance each other's work. So basically, without the vitamin A, you're wasting your time with the vitamin D, whatever it is. And the reason is vitamin A enhances the ability of the vitamin D for calcium absorption and immune function. I should have said earlier that the benefit of the vitamin K2 is not about just removing the calcium and take the calcium where it's needed. Personal experience, since I started taking it, it's been over 9 years or so, almost 10 years. I never had a cavity because vitamin K2 protects your teeth from decay that leads to cavity and reversed my enlarged prostate and improves the immune system. And it's fantastic for overall health. We're getting to the end of the video. The only advice that I can give to anyone is, as soon as you have the chest pain, even though if it's very mild, it could be mistaken with the indigestion. So you want to check with your nearest hospital to rule out arterial blockage. God forbid, if it's arterial blockage and this condition keeps going on for quite some time, it might damage the heart muscle, and later on in life, it could lead to heart failure, and it's fatal. So you want to avoid that. And make sure you subscribe and ring the bell so you won't miss the next video. And share the video with the loved ones and friends. They might benefit from it. And thank you so much for watching, and see you in next video.